like to highlight that one of the critical components to success in complex eye surgery is having a core nursing team that's well versed in complex eye surgery. And what I mean by that is they're well versed in the different types of techniques in complex eye surgery, and they're very well versed in the appropriate instrumentation for these techniques. Often in complex eye surgery, the surgeon intends on going with plan A. Let's say that's Yamani interscleral haptic fixation, and for whatever reason you may need to convert to a CZ70BD, or you may decide to, or if you're approaching a very complex dislocated cataract and you need to convert to M6, it's a big plus to have a core nursing team that knows how to anticipate for these things and also know what instruments to call for, what instruments to order, and that makes a huge difference in terms of the overall success of the case. And basically, it just goes beyond just knowing what to put on the surgical field. It's just knowing what to anticipate for, and just having that close dynamic, you know, discussion with the nursing team, notifying them ahead of time of what the case involves, what you'll need, what your backup lens will be, and then just basically going over with them in details, because I think that they also appreciate it when you're actually, you know, telling them what you're thinking or what you're planning on doing, what backups we'll need, or why we need to order a backup lens of a backup lens. And so all these things, uh, from my own personal experience, having done a lot of these complex cases, is that one of the critical components is to have a dedicated nursing team that that knows these cases, because they're very different than your traditional cataract surgery. In cataract surgery, the steps are very predictable for the most part. But in these surgeries, it's very dynamic. The surgeries are very creative, and so often you're jumping from step A to step C. Often one form of secondary IOL fixation may not work at the time of that surgery. Some of these cases are time sensitive, impending. If you're approaching a dislocated cataract or dislocated lens, there are some steps during the surgery that are time sensitive. And so just having that core nursing team is something that I've come to, appreciate as one of the most critical things in the flow of the surgery and ultimately in the outcome of the surgery. Anyways, I hope you found this to be useful, and thanks for watching.